The criteria and experiences of phenomenal clinical care and personal relationships with personal health are something that is radically subjective to every individual and should be approached by the industry, by the organizations, institutions, and systems of healthcare as such. What is and what can be defined by phenomenal healthcare? Today on The Sociologist, we're talking about the social impacts, the philosophical definitions of what phenomenal healthcare means. Phenomena are the experiences, the perceptions of every individual. Our perceptions, our experiences are going to be unique to each of us in regards to clinical care. Clinical care is not a one-size-fits-all. It is not a normative solution for every individual patient. People have different injuries, different contexts, autoimmune diseases, prior histories. Outside of that, we have all of these soft sciences, all of these social aspects about clinical care. All of these different criteria, all of these different metrics for what one person's experience with clinical care makes up their perceptions of it. This perception can be very unique, and our approach can be just as unique. Within medical care and clinical care, this is becoming known as precision healthcare, taking into account somebody's schedule, taking into account somebody's weight and overall health, taking into account somebody's pre-existing histories and history of disease, taking into account somebody's dietary preferences, taking into account somebody's sport, taking into account functionality, taking into account somebody's suspicions or trust within clinical healthcare. Do we trust surgeons more? Do we look to psychologists? Do we want a more naturopathic remedy, or do we want surgical interventions? All of these are not just specific but subjective to every person. This precision approach can be adopted through the study of these experiences, known as phenomenology, the study of phenomena, experiences, perceptions, everything that has happened to us. Distrust in institutions, distrust in systems, in healthcare is at an all-time high. The CDC, the NIH, the MIB. We have a tendency to not trust these faceless entities, these things that are so dehumanized, so detached from our own experiences, to be able to look something in the eye and trust it. We may trust our teachers, we may trust our cousins, we may trust our family members, we can even trust parasocial relationships in the media. If there are podcasters, if there are news hosts, if there are influencers that we like, that we follow, that we trust, that we see and perceive on a regular basis, those will have more trust than the CDC, which we only see once in a pandemic. So regarding individuals and distrust in healthcare institutions, that is something that was likely fomented over a lifetime of experiences, thoughts, and attitudes. It's not going to be easy to be undone or that directionality changed in a conversation that lasts a few minutes, no matter somebody's credentials, no matter a healthcare professional's acumen and experience in the field. Navigating around these social structures can be done, just like navigating around autoimmune diseases, just like navigating around allergic reactions, just like navigating around dietary restrictions. All of these are the individual puzzle pieces that make up the individual in front of us. So when a patient across from us has a distrust in the healthcare systems, there's likely reasons for this. Maybe they lost somebody in a hospital as a child. Maybe they or someone they knew had an adverse reaction to some vaccines. Maybe they were medically injured. All of these experiences are phenomena that craft a person and an individual a specific subjective experience within clinical healthcare to be able to provide a more personalized, precise approach specific to these individuals. So regardless of any empirical reasoning that may be or not be in a person's experiences, in their attitudes towards clinical or healthcare in general, those feelings, those attitudes are going to be difficult to be invalidated. And most would argue it is not in the patient's best interest, nor the public's best interest, nor the best interest of the healthcare providers, the clinicians providing this care, to try to argue, to be argumentative and invalidate this. We're not going to change their minds very quickly. It's taken 5, 10, 50 years of experience to make those opinions. So hopefully this path forward to best practices in the future will take into account these psychological, philosophical, personal, parasocial, and physical components to make a cohesive healthcare plan, a plan of approach for every individual person, making a more personalized, a more precise healthcare treatment experience for individuals, for the institutions, for the clinicians, healthcare providers, and for the public health as well, to start adapting and navigating these relationships between the public, clinicians, individuals, and the systems in place.